For young people, and especially for the vulnerable youth, the COVID-19 crisis poses considerable risks in the fields of education, employment, mental health, and disposable income. Moreover, while youth and future generations will shoulder much of the long-term economic and social consequences of the crisis, their well-being may be superseded by short-term economic and equity considerations. To avoid exacerbating intergenerational inequalities and to involve young people in building societal resilience, governments need to anticipate the impact of mitigation and recovery measures across different age groups by applying effective governance mechanisms. Princess Lavia Tete is a youth advocate. She tells me young people, especially young women, have expressed concerns about the toll on mental health, employment, disposable income, and education. Despite the flexibility and commitment shown by schools and teachers in securing educational continuity during school closures, not all students have been able to consistently access education.
There hasn't been any intervention for the youth or any intervention for adolescents, and it's very alarming because we've recorded increase in teenage pregnancy, increase in school dropouts, we've recorded increase in educational barriers where most of our young girls and our young guys have stopped going to school because of economic hardships. We've realized that those in the rural areas are being left behind. So what we are telling government is that government should bring approaches on a holistic approach, which it targets all vulnerable and marginalized groups.
For people with disabilities, COVID-19 challenges are a lot like daily life. Their ability to achieve economic security and independence has very often been a goal kept out of reach by a variety of societal assumptions about their ability or inability to reliably fulfill professional requirements. Wisdom Edufu Kofi is the leader of Ghana Association of Persons with Disability. He shares the challenges he and his colleagues have been facing.
During the lockdown and up to now, there are a lot of challenges in person with disability that we are facing in various of the assembly, simply because the disability common fund, we are thinking that it will be of help to us. But currently as I'm talking to you now, I've been chair for one of the districts. I have not have any information up to now that 2019 and 2020 disability common fund has come as I'm talking to you now. And sometimes when you approach our social welfare department, they only tell you it's not ready yet.
Caterers under the school feeding program are also lamenting the delay in payment for their services. According to them, they haven't received any payment from the government since September 2019. The delay in their payments has affected their livelihood sustainability, and their debt with banks keep increasing.
We are no more processing the cassava, and so no more work at the factory. They are all in the house. And the government also didn't pay us so that we can pay the women. We all went home empty. We also now in debt because we took a loan from the bank. So when the money came, the bank manager refused to give us even 1 cedi to give it to our women. We are now stranded.
Civil society organization Send Ghana says COVID-19 is putting people from various social groups in vulnerable situations, which requires an intervention that can be carried out efficiently and effectively for relief to be provided as quickly, in the best way and to the most amount of people as possible without discrimination.
We are very much interested in people who are receiving existing social protection interventions, those who have the potential to receive it, and those who are managing it, to get a sense of how things have been since we had the pandemic here. It's very important to get some feedback to government, so then in design and implementation of COVID-19 alleviation programs, government will be mindful about what the beneficiaries of such interventions feel.